How many of you get the flu shot during flu season? And how many of you end up getting the common cold, but nothing much worse than a stomachache and sore throat? Well, you can thank the flu vaccination for that. The idea of preventing diseases and further creating vaccinations has been around for over 1,000 years. But recently, some controversy surrounding vaccinations has been making light. People are starting to refuse vaccines and refusing vaccination of their children. However, I am here to tell you why you should vaccinate yourself and your children. This topic piqued my interest when I started reading articles claiming vaccinations cause autism. I have an 11-year-old cousin with autism, so this angered me. I needed to know more about this topic. I discussed the concept of vaccination with my neighbor and my aunt, who have both been nurses for over 15 years. In addition, I recently talked to my own doctor about vaccinations and the anti-vax movement, so I have gained quite a bit of knowledge on the subject. In my speech, I plan on persuading you that vaccinations should be enforced by describing the results of refusing vaccines, how they can prevent you and your child from becoming ill, the safety and effectiveness of vaccines, and how they protect the people around you. First, I would like to tell you a story about Amy Parker. Now 37 and a mother of two, Parker tells Voices for Vaccines what it was like when she was a child. Amy was raised on the most organic and strictest diet you can imagine. Anything she ate had to be grown organically, she was refused sugar, and was restricted from any additives and MSG. Now you are probably thinking she is one of the healthiest people ever. Unfortunately, being that healthy was not enough to prevent illnesses. Parker was never vaccinated as a child, and because of this she contracted measles, mumps, rubella, scarlatina, whooping cough, tonsillitis, and chickenpox. Most of these illnesses are preventable with common vaccinations. If Amy's mother had had her vaccinated, she might have been able to avoid the pain and misery from contracting these illnesses. Just because a person is healthy does not mean they cannot contract these dangerous diseases. Luckily, Amy has used her experience as a reason to vaccinate her children, and why she encourages every parent to do the same. Next, there are a plethora of complications that arise due to the refusal of vaccines. Choosing not to get you or your child vaccinated poses more threat than just the obvious increased chance of contracting a disease. In fact, according to Dr. McGowan, for children who are unvaccinated, some estimates as high as 5 to 8% of them have a serious infection in their bloodstream or around their brain. Having your child catch the chickenpox may not be enough for you to get him or her vaccinated, but a possible infection in their bloodstream should. Taking your child to the doctors or hospital has become a much more extensive and intense visit. For just a fever, you'll have to witness your child go through hours of painful testing, such as multiple blood tests, urine testing, a chest x-ray, and depending on the child's age and other risk factors, possibly a lumbar puncture. If your child was fully vaccinated, finding out the reason behind a fever will be simpler and less painful. A common misconception of anti-vaccination believers is that most people do not usually get the disease that vaccinations prevent. However, due to this thinking process, there have been outbreaks of diseases in New York City, Orange County, California, and the Ohio State University area. As a matter of fact, the mumps outbreak in New York City and Orange County has led to 483 infections in 2014, as of the last week in August. These easily preventable outbreaks are caused by a false assumption. Another delusion behind the refusal of vaccines is that enough people do get vaccinated, therefore the disease is not likely to be contracted. Studies show that California has a vaccination rate of 92.7% of the measles, mumps, and rubella, or MMR. Colorado has a disheartening 85.7% vaccination rate. These numbers are extremely low compared to Mississippi's 99.9% rate. Further exemplifying low vaccination rates, patients that were asked if they have been vaccinated during childhood by Columbus's Deputy Health Commissioner responded with only 80% said yes, and we were able to confirm only 42% overall. This percentage is disturbingly low and needs to change. An outbreak of the whooping cough in Japan in the mid-1970s demonstrates how these vaccination rates can be dangerous. In 1974, there were only 393 cases of whooping cough in the country. No one died from it. An anti-vax scare caused the vaccination rate to drop to 10% in the following years, and by 1979, the country was in a grip of a whooping cough epidemic that infected more than 13,000 and left 41 dead that year. The possibility of this situation happening again is high as long as the vaccination rates are low. Refusing to get yourself and your child vaccinated clearly impacts more than just your immediate surroundings. Deciding not to get you or your child vaccinated causes so many complications, hazards, and threats to not only you, but also your child. It is so crucial to everyone's health to get you and your child vaccinated. As a result of this growing refusal of vaccination, I have created a solution. The goal is to increase vaccination rates, and this can happen with the passing of a specific health insurance bill. This bill will consist of health insurance companies requiring vaccinations of their policyholders. To demonstrate, if you have Aetna as your healthcare provider, they will require you and anyone else under the plan to be up to date with all necessary vaccinations in order to continue being covered. This bill will help increase the vaccination rates and the health of the policyholders. I have created a plan that will be effective in encouraging more people to get vaccinated and thus protected from diseases. To illustrate the benefits of this solution, I will explain why vaccinations are so important to you and your child. Most people have a preconceived notion that vaccines are unsafe. However, this is not true. Vaccinations undergo extensive testing to show that it works and that it is safe before the FDA will approve it. Part of this testing are clinical trials that compare groups of people who get a vaccine with groups of people who don't. In addition, the FDA is not the only organization that encourages the safety of vaccines. The Institute of Medicine, American Medical Association, American Academy of Pediatrics, and the U.S. Department of Health and Human Services state vaccines are some of the safest medical practices available. Vaccines go through rounds of testing before it is in the doctor's office. Contrary to belief that vaccines are not safe, there is plenty of evidence suggesting the safety of them. Next, vaccines are not only safe, but they are extremely effective. They help your body's immune system become familiar with the disease and train your system to fight off the germs. The process will help your immune system protect itself against these germs in the future. In fact, childhood vaccines produce immunity about 90% to 100% of the time. Getting your child vaccinated will protect him or her from 12 or so potentially serious diseases. There are quite a few diseases and illnesses in the world, but vaccines help prevent you and your child from contracting at least 12 of them. Further proving the effectiveness of vaccines, the Center for Disease Control estimated that 732,000 American children were saved from death, and 322 million cases of childhood illnesses were prevented between 1994 and 2014 due to vaccination. These statistics prove that getting vaccinated can save you and your child's life. After multiple studies conducted over the years, there is no doubt about the life-saving effectiveness of vaccines. Furthermore, vaccinations protect more than just you and your child. They protect everyone around you. The concept of herd immunity is introduced regarding the protection vaccinations provide. The definition of herd immunity is when a critical portion, the percent of people who need to be vaccinated to provide herd immunity, of a population is vaccinated against a contagious disease that is unlikely to cause an outbreak of the disease will occur, so most members of the community will be protected. When someone sick comes in contact with vaccinated people, the disease will have no one to infect, thus die out. On the other hand, when fewer children in a community are immune, it is easier for a disease to spread from person to person and cause an outbreak. Getting vaccinated protects you and strengthens the herd immunity, protecting the people around you too. Finally, by describing the results of not getting vaccinated, how vaccines can prevent you and your child from becoming ill, the safety and effectiveness of them, and how they protect the people around you, I aim to persuade you that vaccination should be enforced. Vaccinations are one of the most beneficial medicines that science has ever created. There are so many advantages to getting you and your child vaccinated. Therefore, I ask you to take action and complete 2 steps. The first step is to catch up on you and your child's vaccinations. Make sure both of you have the necessary vaccines. The next step is to sign a petition for my proposed bill to help get it passed. I also encourage you to spread support of the bill to everyone you know. If we all do our part, this world can become a safer, healthier place thanks to vaccines.